Hello and welcome, everyone. We're just going to give it 1 minute as participants are entering into the webinar. All right. Welcome. My name is Jessica Collins. I am the Executive Director of the Public Health Institute of Western Mass. We are thrilled to have so many of you joining us today on this imperative issue in our society today, and just really so happy that so many people are interested and so many of us will hear this important information and take it forward to our organizations, friends, families, and society at large. So the Public Health Institute of Western Mass does research, we do community assessments, we build coalitions, and we do policy advocacy and communications around very important and emergent public health issues. And so today we are here to talk about social media and our youth. We do want to go over a couple of housekeeping issues for today. We will be recording and slides will be shared. After the webinar, we will send it out to the emails that our registrants have supplied us. If you click on show captions, you can enable automatically generated closed captioning. For the use Zoom chat features, you can put comments in and reactions if you'd like. We do ask you to put questions in the Q&A, and we have time for that later on in the program. Before you sign off, we are going to ask you to fill out a survey, and we would appreciate you just taking a minute to do that for us at the end. And if you have any technical difficulties, please direct in the chat to one of the hosts. So I'm very excited to introduce our board president, Luz Lopez. She is going to moderate our webinar today, and just grateful for you, Luz, and all you do for the community. She is the co-founder of Breaking Oppression, which works with youth and family members in our region. And I will hand it over to you, Luz. So thank you.
Thank you. Thank you, Jessica. And thank you all for being here today. I'm very excited to hear this information today. I'm a mother of a 9 and a 10-year-old. So this is something that's very important to me. And as Jessica mentioned, I'm the director of Breaking Oppression, and we work with youth 13 to 17 years old around alternatives to violence. So this is very important, mental health, screen time, social media, all of these things that are right at the top of our list of what we need to be talking about to make sure that our youth are safe. So today, our webinar, we're going to have Dr. Jill Walsh, founder of Digital Age, and also the sociology lecturer at Boston University. She will be providing a presentation for us, and we also will have a presentation by the Attorney General's policy work with Attorney Liza Hirsch, the director of the Children's Justice Unit in the Office of Attorney General, Andrea Joy Campbell. We'll have some time for questions and answers, and then we'll give it back to Jessica to close off the webinar. So thank you all for being here, and thank you, Dr. Jill. I will hand it off to you for your presentation.
Great, thank you. I'm so excited to be with all of you and to be sharing these ideas with you, but please, please know, in half an hour, there are so many other things that I could discuss and would want to share with you. And so what I'm hoping to do is really just sort of scratch the surface, raise some important issues, things that are really front of mind in my work with students in this area, particularly this past spring through this fall, some of the things that are emerging and are on our minds as educators. I'm also a parent of 2 teenagers, so I can tell you they're on my mind as a parent. And also I've had the real privilege this summer and fall of working with Liza and thinking about, policy work and things that we could do to improve this for students. So I want to just sort of give you, a 30-minute kind of high-level overarching presentation of the things that I think are most crucial for us to be considering right now. So first and foremost, I want to start with this idea of reframing our thinking. I think sometimes whether we are educators, whether we work with kids in communities, or we're talking about kids in our own homes, we often feel like because we are not experts in TikTok or Snapchat, that we can't really talk to them about this topic. And I actually would encourage you all to think about the fact that you can play a tremendously important role in kids' lives around technology, even if you never use any of the platforms or play any of the video games that these kids are playing. Because of this first point, the digital challenges that kids face are often amplified versions of their offline experiences. So what I mean by that is meanness. Meanness exists during the school day. It exists after school and on the weekends. When it happens digitally, though, it's amplified, right? So you feel worse, and right, it's because they can see it and they're looking at it over and over again, right? All of this kind of stuff. But the notion that it's inherently different or something you can't talk about is really not true, right? We can talk about what it feels like when people are mean. We can talk to them about what it feels like when we're left out. And yes, it feels harder for them. And I believe truly that it is harder, but there's still an entry point for us. The other thing that I would like to really push our thinking on today is that even though there are definitely platforms that I like more than others, right? I'm not going to tell you that they're all the exact same thing. I don't believe that there are any inherently bad platforms, right? So if you wanted to say, like, I get a question a lot, like, is Snapchat okay? And unfortunately, and I know it's not appealing or what you want to hear, but the answer really is it depends. And the reason it depends is it depends on your kid. It depends on the kid in front of you. And it's really about what's challenging for them. So what I mean by this is if you have a kid that is dealing with impulse control issues, Snapchat's going to be really challenging for them. If it's a kid for whom, dealing with image and feeling like they have to keep up, then Instagram might be really hard or TikTok might be hard. If you have someone that can't step away, that dopamine hit just needs to keep happening, YouTube might be hard or gaming might be hard. And so the reality is we have to really think about what's best for the child, not necessarily what's like good or quote bad. The other thing related to this is that the quality of what kids are consuming is as important, I might actually argue, if not more important, than the quantity. We as a society have hyper-focused on quantity, like, 2 hours or less when they're young, or, these sort of like barometers. And it sort of implies that like if they, watch something for 2.5 hours, their, brains are rotting. But if they watch it for an hour and a half, they're doing great. Quantity does matter, don't get me wrong, but we actually really want to think about quality. And so quality, of course, right, the obvious things, we don't want them watching things that we would not want any kid watching. That's of course true. But also quality in terms of active versus passive consumption. So what I mean by that is if I am just passively consuming and scrolling through Instagram or just watching the next YouTube video that uploads, I am generally not having the quote better experience than if I'm a kid who is connecting with friends on FaceTime, right? That's active consumption. Or I'm really care about climate change and I'm engaged with some group that is doing climate work in other parts of the country, right? Those things are active consumption. And so while we want to think, of course, about things like not watching pornography or things like that, we also want to think about active versus passive consumption. Generally speaking, the kids who are doing, quote, better in terms of their well-being in this space spend more time in the active consumption. Now, I gave an example of climate change that was sort of grand, right? Assuming kids were activists and engaged in the world. That's wonderful if they are doing that. There's a lot of kids doing that. But also, active engagement can just be hanging out with friends, right? So gaming together on headsets, that's also active engagement. The other thing to keep in mind, and I'm going to circle back to this at the end, is that while there are some really negative and scary things that happen, and I'm going to address those, I do want to remind you that for most kids, most of the time, this is social, positive, and developmentally appropriate. And so it's, we do want to have conversations, but we don't want to assume that everything is always awful because this is kids' avenue into connecting with each other. Oh, excuse me, yeah. Now, one of the things you might be thinking is, okay, but what about the specific links to mental health, right? Like, what do we know? It's percolating in the, ether right now as everybody's sort of talking about the link between tech and mental health. And I want to just let you all know what we actually can say for sure. There is clearly a correlation between tech use and mental health. And in terms of more tech use tends to correlate with worse well-being and worse mental health outcomes. What we don't have a good handle on yet is what is actually happening in terms of the directionality and also the causality. So I'll talk about both of these. Directionality, what I mean by that is, it is absolutely the case that a kid who is consuming a lot of technology could develop symptoms around anxiety or depression, right? That's one direction. So the tech use is causing, right? The other thing, though, is that what we do know is kids who are dealing with depression tend to consume more technology, right? They spend more time on social media. In that case, the direction is actually going the other way. It's the mental illness that is causing more tech use. And so as you can see, it's a little bit complicated to figure out how this is actually playing out, right? So thinking about that through that lens, the other thing about causality is, as you can probably, oh, excuse me, I switched the slides. As you can imagine, there's probably a lot of other things going on, right? Sleep is going to be impacted by, high tech use, and sleep has deep impacts and implications for teen mental health. And so it's really hard for us to tease out in these situations. This always leads to. The other thing that's really challenging for us in 2024, I'm excited about it, but it's hard. It's not a satisfying answer for all of you. I'm excited about it because what we're starting to understand is that social media in particular seems to impact some kids more negatively than others. I'm excited about that because I think that might get at some of the reasons why this data is so confusing and why we can't get to good answers on this. But again, it's an it depends answer, which is not very satisfying. Questions that we're thinking about, things that are still on our minds. Is it the person? In other words, is it the innate characteristics of the individual child and, how they're wired that makes it more negative? Is it the time of day, right? We know that late night consumption tends to be worse for all the obvious reasons. Is that the factor? Time might also mean amount of time on the screens, right? That matters. Is it the content? Is it what they're looking at, right? So then we would have to understand that. Or is it a combination of all of these things? Is it the specific platform, right? It's so complicated and nuanced that this is the work we're trying to do right now. But it is sort of exciting as a researcher. I will tell you as a parent, it's really dissatisfying, right? Because I just want to know what's the best thing to do for my kids. I will highlight, though, one research study that I find particularly compelling. It is probably my favorite researcher. I think the gold standard of this work is Amy Orban. She's out of the UK and she does a lot of meta-analyses. So she kind of looks at all the research that's out there and pulls together what she's seeing. One of the studies that she released at the end of 2022 that I was really excited about is looking at young adult mental health. So I teach college students, it's that population, 18 to 24, asking them about their current mental health, and then asking them when they got access to social media. And what she noticed in this work is that young adults who experienced worse mental health outcomes also seemed to be the people who reported getting access to social media between these ages, 11 and 13. And so she started to refer to this as the special vulnerability, implying that there's something particularly vulnerable about these ages of 11 to 13 that might make or predict worse outcomes for kids versus kids who get access to social media at 15 or 16, right? Where we tend to see better long-term outcomes. I'm excited about this research. Again, I think she's phenomenal, but also because it is sort of looking longitudinally and not just, did you see the thing and then feel worse, right? But more work has to be done. And she acknowledges this, right? Understanding of things like, what were they looking at, right? How long were they on? Again, all those questions still remain. So this is phase one of her research, but I'm excited about it. I'm compelled enough that when I'm working with schools, I'm really talking about this age as an age group, this 11 to 13, where I would say, I don't see a lot of reason for kids to have access to phones during the day. I don't see a lot of reasons for us to be talking about getting access to social media in this age group. And as you can probably imagine, sadly, my 12-year-old daughter, who was 12 at the time when I read this study, I was like, nope, sorry, you have to wait until you're 14. She was not happy that I read this study, but I'm very compelled by it. I think it's really good work. And so I wanted to share that with you. The other thing, though, where I do feel like, okay, we do want to pay attention. These are some areas of concern that come up for me a lot around mental health, right? So when I would say it depends, it's all of those things, yes, there are some specific things we want to think about. The first one is this notion of social comparisons, right? And how a lot of us who work in adolescent development refer to it as compare and despair. Because as you can probably imagine, no one, when you're comparing yourselves, we are wired to compare upwards, meaning we pay attention to the people who are doing better than us at whatever our metric is. And so when kids are scrolling through social media, they're paying attention to the person who looks better than them, who went on the better vacation than they were able to go to, has the cooler sneakers, whatever that measurement is for them, they're going to be paying attention to the people who are doing better than them. And I think this is the data that's borne out time and time again. And in fact, if any of you remember when Frances Haugen shared the internal data from the company, we would now say Meta, but at the time, Facebook, when she in 2021 shared that information with the Washington Post, most of the internal data Facebook had at the time about the negative implications for mental health were around comparison, right? So they've known this for years. They're not doing anything about it. And I do think this is really an important point. The one thing I really want to say about social comparisons is I get very, very frustrated in the way our media presents this as a girl problem, right? This idea that it's girls who compare themselves. There is no really good data that shows that gender identity impacts social comparisons. We have conditioned girls in American society to talk more openly about social comparisons, but I can tell you that when I am doing one-on-one interviews with kids, regardless of their gender identity, they are talking to me about comparisons. And in fact, one of the things that I feel really comfortable in making a causal relationship to is this notion of comparison and the rise in disordered eating amongst adolescent boys, right? And that they are comparing themselves as well. They don't feel as comfortable talking about it openly. And so they're not captured as often in a, New York Times quote, but they are there. And I really would encourage everyone to talk to every kid about this and not think of this as something you should just focus on with teen girls. And I just shared this quote. I think it's a really interesting quote that a 9th grader shared with me when we were talking about social comparisons. And they said, I know that that's a highlight. I know that was the best picture of the night. I know. And yet then they said, I want to feel what that looks like. In other words, I just want to feel how happy they look in that picture, right? And I think that's really telling of the impact of social comparisons. The other thing that is always on my mind, and probably the thing I talk to most often about with kids in middle school and high school when I'm visiting schools, is this second point of friends serving as mental health counselors. This is a very common problem. Again, no connection to gender identity or anything like that. It comes from the wonderful place of kids trying to be good friends and support each other. But what we're seeing happen is that a kid will reach out to someone and be like, hey, are you okay? And they can do that with their device because they're so easily connected through this device. And then the other child might say something like, no, actually, I'm not, or, I haven't eaten since yesterday, or, I can't get out of bed or something like that. And then the child, trying to be a good and supportive friend, starts to say things like, what can I do? How can I help? And this is nothing new in terms of this could have happened in the 90s, right? But this notion of being constantly available to our peers is creating a really, I actually would say, a very dangerous situation for both kids. Right? One is the kid is obviously not qualified to provide counseling services. And the second is the kid who really needs help, who might not be getting it because they're so reliant on a friend. This is one of those topics that if you work with kids and you ask them about this, they will all know what you're talking about. And they won't necessarily tell you in a big group, oh, yes, this is happening to me. But this is the one where when I raise this with a group of kids and we talk about it, it is invariably the one where I have kids lined up after who want to talk to me about their individual situation. So I would definitely encourage you to think about that. And really what kids need is some understanding of A, how to create boundaries, right, around friendships, and B, to understand what's the line. A lot of kids will ask me, what's the line between being a counselor and a supportive friend? I don't get that, right? And so they need some help in that work. The last thing I wanted to, make you aware of or encourage you to think about are these algorithmic rabbit holes. There's a lot of work that's been done around this. Kevin Roos does great work on this. He did a great piece for the New York Times Magazine a couple of years ago about algorithmic rabbit holes, if you want to read that. But this is where kids are being nudged to more extreme content, right? So they might be going to, they're looking at gaming videos, which are totally benign and fine, but then the algorithm nudges them to anti-Semitic content, right? Or things like that, or homophobic content. And they start to see it. And then of course the algorithm goes, oh, you watched that video, let me give you more, right? And so it continues to be this loop, which can be really powerful and impactful for kids. The challenge then, and I'll talk about group chats in a minute, but the challenge is that language then is showing up in group chats. And so kids are seeing it and social media, and then their peers are perpetuating it in group chats. And this dialogue, this meanness, hate speech, explicit content is really becoming normalized in young people. I spend a lot of time at schools, especially in K-8 schools, where teachers and administrators will say to me, like, I've taught for 20 years. I'm horrified by the language that second and third graders are throwing around to each other, right? And so again, it's a lot of this. The other space I want to make you aware of, given the focus on mental health, is Mental Health TikTok, which is a whole community within TikTok. It's massive. It's good at, like anything. It's good, bad, and neutral. But what we do know is that kids who spend a lot of time looking at mental health content, right, especially if they're watching people talk about their depression or things like that, it's leading to increases in self-diagnosis, right, where kids are saying, oh, that's me too, I have that. It's also creating community and belonging in spaces that maybe we wouldn't want community and belonging. And by that, I mean like self-harm communities, right? Kids are connecting around that kind of stuff in these spaces. So it's a plus and minus, right? I love the idea of people being able to talk about what they're dealing with around their depression or anxiety or OCD. That can really reduce stigma, can make kids feel less alone. I love that part of it. But what really worries me is there's this sort of like group belonging and identity work that can be happening in these spaces. So I just alert you to that. I'd be happy to talk more about mental health TikTok in the Q&A. The last big topic that I wanted to sort of allude to is this group chats. Group chats are pervasive, literally they can run from 3rd grade through 12th grade. Group chats are often they can start on gaming devices. They can even start happening on Google Docs. But if schools are giving out a device for kids to work on in academic context, they can be messaging each other as well. And of course, there's ways around all these things. For some kids, group chats are just fun and silly ways to connect with their friends, right? It's just like passing notes, right? It is nothing more than that. But other kids find group chats very overwhelming. There can be a lot of pressure to respond to everything immediately. And this is really impactful for kids who maybe do get tech breaks, right? And then they'll pick up their phone and see that they have 75 missed texts. And then they're trying to catch up and like, what did I miss, right? All of that kind of stuff. That can be very overwhelming. And the other thing is that kids are often feeling like they have to respond correctly. So some kids will say to me, someone posts a picture, sends a picture to the group chat, and everyone has to say how great the picture is. But you can't just write great pic, great pic, great pic, great pic. I have to come up with something different, right? I have to come up with a new way to say that. And that can be really challenging for kids. And again, this meanness or offensiveness that we're seeing playing out, again, partly from these rabbit holes and exposure that kids are having. But there is I would say for me, it's alarming, increase in meanness over the last few years. And this roasting culture where we make jokes about people that are, offensive or downright mean, right? Those kinds of things that we, want to think about, they're happening for kids. I was talking to a principal of a K-6 school, and he was saying, back when I started teaching, it was the kids who had older siblings, right? Those are the kids I worried about because they'd come in and tell everybody about something, right? And he's like, but the problem now is everyone is the older sibling because they have access to all of this stuff. And I think that's a great way to think about it. For kids who experience this meanness in the group chat, it is, again, it's amplified. It's more than just mean. It's meanness in front of a group. And that's incredibly embarrassing for a lot of kids, right? It just feels like everybody saw this. So I think that's really important for us to pay attention to. But this was a quote from an 8th grade boy last spring when I was in a focus group with a bunch of kids, and I asked, like, why is this happening? What's going on? And he said, mean stuff is what's funny. Being willing to say the inappropriate thing can make you seem cool. And again, these are the models they're seeing. The people who are going viral on TikTok or, the videos that are generating a lot of views on YouTube, they're people who are, they're saying the bad thing. They're being intentionally provocative, right? All of that kind of stuff. So just thinking about this in this context and recognizing how often this meanness is pervading all of these digital spaces, it really is having a really negative impact on kids. And so some of the things for us to think about as we work with kids, whether that's at home or in schools or communities, first of all, we have to talk to them about being comfortable in social conflict, right? And actually saying like, hey, that's not okay, right? Kids will say to me, right, when I say like, so they'll tell me something mean that somebody did. And I'm like, okay, so what did you say? And, and the best one was a kid who said to me one time when I was like, so how did you respond? What did you say? He goes, what do you want me to do? Say that hurt my feelings? And, of course I was like, well, that was what I was thinking, right? But, not necessarily helpful. But anyway, the point being like this idea of like just saying, hey, that hurt my feelings. It felt to him like that friendship would be over, right? How could you actually talk about that, right? So helping them understand that social conflict is actually normal, right? Now, it's kindness, right? It's not just shooting off darts at each other, but it's really about generating a comfort and familiarity with understanding we're not going to agree. And it's okay for me to say like, hey, you can't say that, right? And that doesn't mean our friendship's over. They're very much like in the zero-sum thing. The other thing I would really encourage you to talk to kids about is the difference between fitting in and belonging. And if you want more information about this, I would highly recommend you look at Lisa Damour's great content. She has stuff for free on her website, as well as through the New York Times. But there is a significant difference between fitting in and belonging. And we use these terms interchangeably. They're not. Kids who get in trouble for this, like trying to be the cool kid by, saying the mean thing or being willing to hurt somebody's feelings, those are kids who are trying to fit in. Right. And when you experience true belonging with your friends, you don't actually have to engage in these kinds of behaviors. Right. So thinking about this difference, talking to especially young kids about this, I think is very important, amongst other things. And the last thing is whenever you're talking to kids about social conflict or how they should handle it, or if you're having conversations about upstanders, a lot of things I hear from kids is that the strategies we give them aren't actually something they could do. And what I mean by this is, when I said like, tell them that hurt your feelings, right? When that kid says to me, I'm not saying that, that's actually not an effective strategy that I've given that child, right? Like that doesn't help that child. And so thinking about giving them a variety of ways they could handle conflict, right? Whether it's you don't respond digitally, but you follow up with the person who's hurt after. There's all sorts of ways that kids can do this work. They just don't have the skills. And so we need to help them with this in really substantive ways. The last thing that I think is really important is this notion of this access to pornography, which you all know about. But I think it's really important for us to name, especially given the way that things have evolved with AI in the last few months. So first and foremost, most broadly, this generation of kids is going through puberty in a world where pornography is free and available on every device, right? That is just the facts. And so we have to think about that. That does impact their development, their sexual identity, what they believe a sexual relationship to be. Kids are looking at pornography as how-to guides, and that, is terrifying. The other piece of this, though, that has evolved in the last couple months is AI-generated pornography of peers. There's now technology that is free and available to all people that does not require advanced coding skills. It's actually very, very basic, that allows young people to take images of their peers and put them onto naked bodies. And in fact, there is a case in New Jersey where a young woman was willing to actually come forward and talk about this in a big way. So what happened to her, and it was actually her peers who did this to her. It's deeply humiliating for kids who've gone through this, and I'll explain why. Even though it's not you, even though you can say, that is not my body, I know it's not, it looks like it is, right? And it can be very, very hard for kids to step forward with this. So I think that's something that we really want to be thinking about and talking to kids about. Sexting, explicit content, it is definitely happening. And so what I would encourage is, whether it's at school or at home, anytime you're having conversations about sex, you want to be talking about online access as well, or sexting or pornography, right? So my line is, whenever you're having the sex talk, have the sex talk, but also the pornography talk. And particularly talking about both the generation of it more broadly in society, which I think we tend to focus on, but also acknowledging the reality that this could be transmitted and shared between peers. I'm very concerned about this AI generation of pornography. I think we in the United States don't have great laws yet around non-consensual pornography. It's really dependent on who finds out in the police department and, what happens. And it's a little bit of a mixed bag. And so because we aren't in a good place with this, I'm very worried about this technology coming in. So a couple of things about this. Conversations around this earlier is better. Right. And the more you're willing to talk about this, and more often, the better, because of course, I think we think if we say something to them, they'll go look for it. The reality is most kids are getting this conversation after they've seen it. And, I'm sure that fourth grade buddy is a lovely child, but it's probably not the person you want sharing this information with your child, right? So thinking about that. But before, I think you start on that conversation of actually engaging with a child or anything like that, or even if you're talking about this in schools around social emotional learning, the question of what are the values and what should they do if they see it, right? That one's really practical. The values question is much more complicated, but like actually thinking as a family, what are our values around this, right? That can be really helpful, but actually letting kids know what they should do if they see it. Should they immediately shut down the screen? Yes. Should they refresh their browser so the history doesn't capture it? Yes. Right. Like, but if it's a peer, is that, what's the difference there? What should they be doing in that context? They need help in this. You'll see that's the refrain that I keep going back to. So lastly, what can you do at home, right? All of these things and things I didn't even get to, there's a lot of stuff. How can we help them? One of the things I think we could be doing, and by the way, I would say if we were just all here and I was talking about our own as adults mental health and technology use, most of these would apply as well. Enforcing healthy sleep patterns. No child, whether they are 7 or 17, should be sleeping with their phone in their bedrooms. It just is not it's just too tempting. As I said, sleep is critical. We just really want to pay attention to that. So phones out of the bedrooms, please get them a very cheap alarm clock or figure something out to wake them up. I would encourage you, whether this is at home or at schools or in community spaces, to think about tech-free spaces or tech-free times of day where you can gather away from devices. It's really important for kids to be enforced into that break. You might think about different rules for different apps or platforms, back to that notion of like, there's no one good thing or bad thing. It's about your child. So for example, in my house, I have one child for whom I have stricter time limits around Instagram than my other child. And that's because for one of my children, Instagram is really challenging, right? And so thinking about it through that way. Multitasking is, not a really fun topic to talk about, but it's really important. Multitasking is one of the things that we're seeing and why distraction and focus and attention span, all of that stuff is declining, is because of how much we're multitasking. So helping them set up spaces, again, whether it's at school or at home, where multitasking is limited. Another thing I think is really important, we tend not to think about it, so I just wanted to raise it here, is that a lot of kids, when they're carrying their device around all day, they're getting notifications about things happening in the world. And as we all know, a lot of things that they're getting notifications about are really quite scary. I talk to a lot of kids, unfortunately, who say, yeah, I was like feeling fine. I picked up, pulled my phone out of my pocket on my way to lunch and saw there was a school shooting. Right. And then they don't talk to anybody about it. They just sort of put the phone back in their pocket and they're kind of going about their day. I do think we should talk about news consumption and maybe setting alerts. Do we actually want to get news alerts on our phone? A lot of kids do, because it can be a default setting. That's important to think about. And the last thing I would mention is around tech use in general. Less is always more, right? So generally speaking, anything, even the best platforms, the best engagement, all the positive things kids are going to get are in the first 20 to 30 minutes while they're on the platform. And so thinking about, I would rather a kid, if they're going to game for 30 minutes and do that a couple of times a day instead of, just one long 2-hour binge session. And lastly, always explaining the rules for your kids so that they understand the why. Again, whether that's in the classroom or at home, why are we using tech now and why are we not using it in this context? Really helpful for them. And just to close out, as I said, I wanted to come in full circle and just remind you again, these things I talked about are scary. They are hard. They are things that kids are dealing with, but there are a lot of positive tech use out there that I am seeing kids do. And I wanted to alert you to that. So generally speaking, teens tech experience, it's not a monolith. It's not easy to say all teenagers are experiencing this, right? Because we know that they are quite different. When used in moderation, for some kids, it's just positive or neutral, and for other kids, it's life affirming. And so I wanted to highlight a couple of studies that highlight groups of people that tend to do better actually with more social media use. In general, they're marginalized kids, right? So these are kids for whom, whether it's because of their racial or gender identities, or kids who are differently abled, right? There's a lot of kids for whom they find community and real engagement and affirmation in the digital space. And so there's research on transgender non-binary youth. I did really interesting work right before the pandemic with Asian American teens about beauty videos and being able to see people who look like them doing makeup, right? And how important that can be. And also Black teens using social media as a means of resisting negative experiences that they're experiencing in the world, particularly around micro and macro racism. So there's a lot of work that shows that there's good spaces, but none of these studies are looking at like they're on 20, hours a day, right? They're looking in moderation. They're thinking about healthy consumption patterns. And so again, it's really for us, it's weighing a lot of things. And I love to hear more in the Q&A of questions you all have and things you want to hear more about. But I think I'll stop there and make sure Liza has her time. And thank you all for listening.
Thank you, Dr. Jill Walsh. That was great. A lot of information, a lot of great information. And I really liked one of your slides that said they can't manage this alone. So they need us. So thank you for that. And now I will introduce Attorney Liza Hirsch.
Thank you so much, Luce, and thank you, Jill. That was a terrific presentation. I've worked closely with Jill in this space, and it's just always great to hear you present because you present so much really concrete and useful information and tips. So thank you so much. I'm going to share my screen. Okay, can everyone see that? Is it full screen? Okay, great. So as Luce mentioned, I'm an attorney. I am the director of the Children's Justice Unit at the Office of Attorney General Andrea Joy Campbell. I'm going to be talking about some of the policy work that we're doing in this area, some of that policy work we're doing together with Jill and other experts. But before we get there, I want to actually lay a foundation in terms of how these companies are operating. What are their business practices and what are their design practices relative to the platform. So I'm going to go through that with all of you. Many of you probably know some of this, but it's helpful to know some of the details. I also just want to state at the outset that youth mental health is a huge priority of the Attorney General. And youth mental health and the ways in which social media impacts youth mental health is a huge priority of the Attorney General and our office. So we're actually addressing this issue through a variety of avenues, one being litigation. We filed a lawsuit against Meta, the parent company of Facebook and Instagram, for harms of the Instagram platform on youth mental health. We've also filed a lawsuit against TikTok in the last couple of months. That litigation is ongoing. We also are in process of working closely with community organizations, experts such as Jill Walsh, school districts, and others in the development of a cell phones and social media in schools toolkit to help provide guidance to schools, school leaders, educators, but also parents and school communities more broadly about how do we come together collectively around these issues. To Luce's point and Jill's point, I think we're all realizing that this problem is bigger than what any one young person can solve, but also bigger than what any one family or teacher or school can solve. These are societal issues that we need to take on collectively. So goals for today, really to inform you about how social media companies purposely design their platforms to be addictive, particularly for young people, equip you to inform and guide the youth in your lives. There are no black and white answers here, as Jill mentioned. We want to be thoughtful, but in having those thoughtful conversations with young people, it's really important to first be informed. And empower you to become involved in broader policy efforts and organizing around this work to the extent you're interested and inspired to do so. So here are some of the social media platforms that we're talking about. The most commonly used platforms by youth are Instagram, TikTok, YouTube, and Snapchat. And so why are these companies targeting teens? I think many of you listening to this webinar probably have a pretty good idea, but I want to make it really concrete. Putting up this, this quick poll, how much money did social media companies make from advertising on youth social media accounts, only accounts under age 18, in 1 year, in the course of 1 year in 2022? And if you could just answer this question in your head, do you think that social media companies earned 2.4 billion, 5 billion, 9.3 billion, or 11 billion from advertising on youth accounts? Again, in the course of 1 year. The answer is 11 billion. So that's not 11 million, that's $11 billion. So the stakes are very high here. Companies, social media companies such as Meta and TikTok are intentionally designing their platforms to hook young people on the platforms, to keep them on for longer and longer periods of time, to maximize engagement, to keep them coming back to the platform, because the more they maximize engagement, the more time spent on the platform, the more money they make, frankly. And so these companies have actually studied adolescent brain development, the fact that youth don't have a fully developed prefrontal cortex to be able to make those decisions for themselves. The fact that they're more prone to impulsive decision making. They've studied that and then intentionally targeted youth for marketing their platforms. So this is a graph. This information is from a recent research study conducted by the Striped Research Group at Harvard. And this is just a bar chart, again, showing the revenue earned by these companies in the course of 1 year. You can see Instagram here, $5 billion. This is not all accounts. This is $5 billion earned based on youth accounts alone. Followed closely, followed by TikTok, YouTube, and Snapchat. So Jill was talking about like the importance of paying attention to quality in terms of using social media platforms, and I absolutely agree with that. I think that's a really important part of the conversation. That said, there also is a growing body of research showing that the amount of time that young people spend on social media, especially after a certain point, is correlated with worse mental health outcomes. So the research shows that on average in the United States, teens are spending 3.5 hours a day on social media. That's on average. So there's actually quite a few teens who are spending 5, 6, 7 hours a day on social media. This is on average. This is cumulative use. So this doesn't mean that teens are sitting down for a 3.5 hour period to consume content on social media. Much more often what we see in the current youth population is what experts and researchers sometimes call snacking, where youth are kind of checking their Instagram or their TikTok for 10, 15 minutes at a time. They might get in a couple of rabbit holes, may end up on there a little bit longer than they intended. And cumulatively, over the course of a day, they end up spending 3.5 hours on average. And the research simultaneously shows that using social media for more than 3 hours doubles the risk that teens will have poor mental health. So that is a really startling statistic. And again, quality and the way in which youth are using the platforms matters. It absolutely does. But if you have a young person who's spending, 3+ hours on social media cumulatively a day, you're likely to have a problem. This is another graph from a researcher, Jean Twenge, just really showing. So on the x-axis is digital media use per day. The y-axis is low well-being amongst adolescents. And you can see after about an hour and a half of use in the course of a day, the negative mental health impact steadily increases. And the dotted line is a UK data set. The solid line is a US data set. As many of you may know, the US Surgeon General has actually issued an advisory, on this issue, similar to the advisories that have been issued relative to smoking, cigarettes, seatbelts. This advisory was issued in May of 2023. The US Surgeon General states we are in the middle of a national youth mental health crisis, and I'm concerned that social media is an important driver of that crisis, one that we must urgently address. And actually, more recently, the US Surgeon General recommended that warning labels be placed on social media because of the strong association between excessive social media use and youth mental health harms. So what are the harms we're talking about? I'll go through these quickly because I think Jill Walsh covered them really well. But we're talking about sleep issues. Sleep deprivation is associated with depression and other mental health challenges. Kids stay up late on these social media platforms and getting involved in these kind of toxic peer dynamics and impacts their sleep. They show up at school the next day sleep deprived and not able to really focus on learning, but also focus on positive peer interactions in the same way. Feeling bad about your body, eating disorders or disordered eating, negatively comparing oneself to others, low self-esteem, depression, anxiety, self-harm, also suicidal ideation. All of these mental health harms are correlated strongly with social media use, particularly excessive social media use. So in terms of the addictive design features, I wanted to highlight this. Jill was talking some about the algorithms. So, and I think probably everyone here knows, have heard about algorithms, kind of know generally how they work. But it's worth reinforcing and emphasizing that these companies are collecting an enormous amount of data from young people using their social media platforms. They're tracking how long they're staring at each post, whether they like the post, whether they comment on the post, the level of engagement. And the reason that they're doing that is because they're then using that data to create personalized algorithms for each and every user that maximizes their engagement, that keeps them on the platform, that keeps them coming back to the platform. And the way that they do that is using multiple tactics, but one of the ways is by using intermittent variable rewards, which is actually the same psychological mechanism used with slot machines and in gambling casinos. So this is where they're actually serving up content that is going to lead, that they know the user likes, that is going to lead to that dopamine hit. And they're serving it up not every post, but every third post or every fourth post or in some schedule that research has actually shown is more powerful in terms of having that addictive result. So that's kind of how the algorithms are functioning. And as Jill mentioned, they also can function to funnel youth into some pretty disturbing, harmful content if you're not careful. So if, say, a young person is viewing content on dieting, for example, pretty soon they might get served content on eating disorders and be seeing some pretty disturbing images. So that's just one example. There's also infinite scroll. It used to be that after you scrolled through a certain number of posts, you would be kind of all caught up, and that would be that. You could kind of move on. Now it's infinite. There's no end to the scrolling. You can just keep going and going and going. Autoplay with the videos, the short form videos are particularly addictive. Those short form videos on TikTok or the Reels on Instagram, they're particularly, probably all of us have experienced that. They're addictive for adults as well, but particularly addictive for young people. And autoplay just means that once one video is done, the next one starts automatically. So there's no friction. The user doesn't have to click a button and make a conscious choice to move on to the next video. It just keeps running. Time-sensitive content, that's when a user goes live, or like on Instagram, post stories where they're not going to be there forever. So users, particularly young people who are very vulnerable to FOMO or fear of missing out, feel like they have to get on or they're going to miss something. constant notifications, which Jill alluded to. So these are just some of the addictive design features that we're talking about here. And then social comparison. I think Jill really covered this in depth. The likes, views, comments, beauty features, photo editing. I think it's fairly clear that these features kind of they highlight the social comparison urges that young people kind of naturally have in a way that can be very harmful. So I think, yep, I'm just about at my time. Just wanted to go over some of our policy initiatives at the AGO. So I mentioned our litigation. Litigation is pending again against Meta and TikTok. We're also engaged in social media policy work. So we are exploring filing legislation that would better protect youth from some of these harms of social media companies and platforms. And we're also, in the meantime, because we know that both legislation and litigation can take some time, and these harms are happening now to young people, and we know that schools are struggling with these issues. And so we're actually working to develop a cell phone and social media in schools toolkit, which will include things like model cell phone policies, a guide for developing community norms to the point of this sort of rock and a hard place that parents are between when they're trying to decide when to give their child a cell phone or whether to limit or how to the extent to which they limit social media. Many parents feel like, well, I don't want to give my child a cell phone, or I want to limit social media, but I also don't want to socially ostracize my child. And so that really points to the need for a collective approach where parents and teachers and even youth are coming together collectively and saying, okay, what are the values that we have here as a community, and what are some norms that we can all come together around? And we're actually working closely with Joe Walsh on that piece of the toolkit. And then the third part of the toolkit will be resources for school districts on digital media literacy curriculum resources. So that's some of the work that we're doing in the social media policy space. I also just want to mention briefly a couple of other major initiatives that we have at the in the Children's Justice Unit at the AG's office, because I think they're relevant here. We have a statewide initiative on addressing hate in schools and K-12 schools, including and most especially at the high school level and in the high school sports context, because we continue to see hate incidents coming up in schools. And I mention that because a lot of these incidents are, I think, occurring more frequently because of like the ease with which young people can make these statements on social media, which Jill also alluded to. So I just want you to all to know that the AG's office is a resource on hate, discriminatory bullying, and harassment. And then finally, particularly because Jill hit on this point as well, we actually just launched a statewide youth educational diversion program on issues related to sexting and sharing sexually explicit digital images. And so this is a diversion program that the legislature created as part of the recently passed revenge porn legislation. And it creates a diversion program for young people so that when they engage in these activities, instead of becoming involved in the juvenile justice system, they're diverted from the juvenile justice system, but educated on issues related to sexting and sharing images. And that program, we've actually created an educational pamphlet on these issues, which is available on our website. It's available publicly to schools, to parents, to everyone. And over the course of the next year, we're going to be developing an online training for youth on these issues as well. So just wanted to make everyone aware of that. And with that, I will turn it back over to Luce.
Thank you. Thank you, Attorney Liza Hirsch. That was very important information. Happy to see the initiatives that are taking place at the Attorney General's office, and also talking about the schools, getting the schools involved, like you said, parents, teachers, the youth working together, because this is a huge commitment that we have to make as a community. So thank you for that. Okay. Well, we have some questions in our Q&A, and so whoever would like to answer them, from our panel, we have what is late night or why is late night consumption worse? If
I
either,
can start, Liza, if you want to add in. The reason why we worry more about late night consumption is because if we're thinking about the average teenager, they tend to be pretty tired at night. They're less resourced, less resilient. And so things that might have slid off their back at noon become much harder to manage. And as you can probably imagine or think back to your own, childhood or adolescence, if you see something that's upsetting to you, right, of course, we as adults know the answer is put down your phone and go engage in some healthy coping strategies, right? But when most kids do, when they see like they've been left out or, that comparison stuff, is they go, well, let me look at every other time that I was left out, right? So in addition, it makes them more upset. It also tends to lead to longer consumption because they're then looking for evidence. They would call it receipts, where they're looking for evidence for how, often they've been left out or how much those people hate them. So that can add to it. And then the third thing is often late at night consumption is getting to that like escapism of I just need a break. I'm so exhausted. And that's where we see kids ending up down those rabbit holes more often, right? They're actually not paying attention to what they're looking at. They're really just focused on like mindlessly consuming. And that's where they tend to see that stuff that we would probably rather they not engage with.
thank you. Okay, great. Our next question. How can we mitigate harm of social comparison?
It's a hard one.
I'm going to let you start on some of these, Jill.
Okay, thanks, Liza. I think this one is really hard because I think we all do it. As I said in the talk, our brains are wired, right, for social comparison. And so it's really hard to rewire our brains. What I do know is that the kids, back to that 20 to 30-minute consumption, you just don't have enough time to engage in a ton of comparisons in 20 minutes versus an hour to a 2-hour stretch on Instagram, let's say. So one of the reasons why I like limiting the amount of time is it just limits the amount of negative exposures they have. So one of the best ways I see kids limiting social comparison is by actually literally limiting their time on these platforms and trying to develop some mindfulness around when they notice that they're doing it, that's their cue to step away. But it's really, really hard. It's hard because A, that is how our brains are wired. And B, it's not, as you so well alluded to this, like I had it on the slide and didn't say it. They're actually not developmentally able to manage this on their own. And so the fact that we would think they'd be like, oh, I'm now engaging in social comparison, I should put down my phone. That's really hard for, right, most teenagers. And so that's what I would say is like my, like what I would tell a bunch of adults to do. I think it's really hard when you're 14 to do that. So that's why I say I see the best buffer being around talking about it, normalizing them and letting them know. The second thing tied to Liza's presentation that I think is important around social comparisons is that when I was talking about that Meta whistleblower case around Frances Haugen's data, what was evident in that is that they know that they're making kids engage in social comparisons and they're doing it anyway. And one of the reasons for that is because the more we feel bad about ourselves, the more time we spend on these platforms, right? If I pick up social media and I feel great about myself, I'm going to go out and engage in the world, right? But if I feel a little crummy about myself, I'm going to keep looking. And so I think letting them know that it's actually designed to do this to us is really helpful. And then talking about how we can limit the amount of time so we limit our amount of exposures to social comparison.
And just to add on to the point about, I think it's really important to hold these companies accountable. I think that the social comparison elements and some of the addictive elements of these platforms are so powerful that it's like it's a big ask, as Jill was saying, to ask a young person to sort of resist these very powerful forces. And just to emphasize the point about the platforms kind of knowing about the harms and be very specific. Meta, conducted an internal research study called Project Daisy, in which they removed the likes, like the like button, so that you couldn't like a post, you couldn't see how many likes there were, just to see if it would have a positive impact on youth mental health. They found that it did, that youth mental health improved when they removed the likes. And then they decided to ignore that and go forward anyway with keeping the likes on the platform because it maximizes engagement and it maximizes their profits and bottom line.
Thank you. Thank you for that.
Mm.
So we have a question that says, what unique challenges do Southeastern Mass face regarding youth and social media? But I wanted Jessica to chime in a little bit about the roadmap,
Yeah.
the youth mental health roadmap that.
Yeah, thank you, Luz. So, Attorney Hirsch and Dr. Walsh, we released, the Public Health Institute of Western Mass, through a collaboration last year, released the Youth Mental Health Roadmap for Western Massachusetts, which had 5 intervention focus areas, one of which is social media. But I appreciate this person's question about Southeast Massachusetts, and I'm just curious if I could expand on their 2 questions. Have you seen challenges from a regional perspective, or have you seen or know about local effective strategies that have come up through your research or your talking with people around?
I can start, and then Jill, I'm sure we both have something we can say on this. I think these issues are quite universal. They're happening, with youth all across the country, all across the world, and all across Massachusetts. I wouldn't say that the issues we're talking about are specific to any particular region necessarily, although, school districts, for example, are tackling these issues in different ways. Some school districts have been really prioritizing this work and doing a lot, maybe, implementing Yonder pouches, which are those lock pouches for cell phones, and bringing in experts like Jill Walsh and, increasing counseling services and really tackling this issue, whereas other districts, may just be getting started with all of that. So there is some variability there in terms of the extent to which school districts are really addressing these issues in the context of schools. I will say, just relative to Attleboro, that I presented to 3 groups of high school youth at a mental health conference last school year. And the Attleboro students were particularly engaged. I delivered a presentation kind of similar to the one that I presented here today, but it was more tailored for youth. And they were actually really engaged and inspired, and got back to us and said that they are implementing a cell phone free schools week at their school. And this was led by youth. And they wanted us to come out and give a presentation. So Attleboro and some of the districts in Southeast Mass are definitely engaged on these issues. And while I'm mentioning youth, I just wanted to tackle one other comment I saw, one other question I saw in the Q&A, which I think is really important, which is like engaging youth in the conversation rather than coming at it with this sort of paternalistic, like, you shouldn't be doing this kind of approach, which I think is a really good point and one that we're really cognizant of. And I will say that we are engaging youth in development of the toolkit. We've had youth focus groups. We also have a youth advisory council at the AG's office. And we just actually last week had a full session with them, talking with them about these issues and getting their ideas and input. And I absolutely agree that having youth in the forefront, like helping to lead this work ultimately, is going to be really important. So I just wanted to kind of echo that point in the Q&A as well.
Yeah, thank you. Thank you for that. So we have a question that says, what specific actions can parents and educators take to ensure healthy social media use?
Well, yeah, how much time do we have? Yeah. There's, I think for me, I think there's so many layers to this, right? Question of healthy social media use, right? There's so many different facets. And I think one of the things that might be really helpful around this is getting some clarity about what the focus is. Like, what do you actually want to tackle? And I think I totally agree with Liza that this is really universal. Like, I could talk about group chats anywhere in the country and every kid knows what I'm talking about, right? That part is not. But there is some nuance in terms of what are the percolating big issues, right? And so at some schools, group chats are the problem, right? All the bad stuff is playing out in the group chats. In other schools, it's like, it's not the group chat, but it's the gaming, right? The meanness is all pervasive in the game, right? So I think one of the things is to sort of prioritize what you want to tackle and then think about what that looks like. I think to Liza's point about engaging youth, I mean, it's a really important question of like asking them what they think healthy consumption looks like or healthy social media looks like. they don't necessarily always see it. They don't see great examples from us, I'll be totally honest, right? They look out in the world and they see who's trending and who goes viral. And it's often like the YouTuber who's the most controversial, right, that goes viral. And so they are aware of that, but I think they do have a good understanding of what they'd like it to be like. What they can't do, and developmentally it makes sense, is figure out how to get there, right, without all their peers coming along with them. So I think that's really important. But one of the conversations I think we're not having often enough across the board, regardless of what the issue is about this notion that I brought up around mindful consumption of technology. I don't think we are talking to kids enough about when they consume Snapchat or gaming or whatever, how does it actually make them feel? They feel like they have to be there. They feel like all their friends are there. And so it's sort of forced upon them. But I think when we get kids to understand that, like, wow, when I'm FaceTiming with my camp friend, I'm so energized. That feels awesome. But actually, when I was in the group chat last week, I was miserable, or whatever it is for them, right? Helping them understand and connect how they feel with their consumption, that will go a long way, right? Because what we want kids to do is spend time, like in that FaceTime example, that's where I would want kids to be for half an hour, right? If that's what energizes them, if that's what works for them, that's where I would want them to be. And then I would want them to work on minimizing the time in the group chat that makes them feel drained or worse about themselves or whatever it is, right? And so helping them first connect how they feel with the consumption patterns, and then working with them to build strategies about how to expand the good and limit the bad. I think that would be really helpful.
That was a great response. Thank you. We have, can you say a little more about limiting multitasking, or could you give a few examples of what you mean and what the goal is?
Yeah. Multitasking, as I sort of alluded to, is not a fun topic for anyone to talk about, and how, hello, it's like how I live my life, right? So I completely understand that it's not an interesting one, but what kids do not understand is that when, and maybe adults too, is that when we are multitasking, regardless of if we are multitasking like a homework assignment and our Spotify playlist and a group chat, or we are multitasking 3 fun things like a Netflix show and the group chat and whatever it is that we're multitasking, we are actually eliciting a fight or flight response in our body, which means that we are generating the chemical cortisol in our bloodstream, right? And cortisol is our stress hormone. And so any type of multitasking actually increases stress, even if all the things objectively by themselves are fun. Right. And so what ends up happening, and again, this gets a little bit into brain and habit formation, but what we tend to do is we tend to be like, oh, I'm stressed, I'm going to look at my phone. Then we're multitasking all through our device, and it actually makes us more stressed. And so then our brain goes, spend more time on the tech. It'll make you feel better. Right. And so we end up in this vicious cycle where actually the thing we went to, which of course I hope we develop different coping strategies for when we're stressed, but if we're going there to look for an escape or a relief from our stress, when we engage in multitasking, we're actually making ourselves more stressed. So in addition to kids being more stressed, we're also seeing them then overconsume tech because they're trying to use that tech to manage the stress they created from multitasking. So it ends up in this sort of vicious loop. But I think kids actually need to know that multitasking is inherently stressful. I think they've gotten the message that, like, okay, maybe you don't do your math homework quite as well, but I don't think they actually know that it links to stress.
Thank you. So we have a question that says, do policies restricting cell phone use work? And is there evidence supporting it?
Yeah, I can start on that one. So, all of this is fairly new territory, right? Like, I mean, in the legislative context, there are dozens of bills that have been filed in state legislatures across the country. Many of those bills have been challenged in court, and that litigation hasn't concluded. So we are in the very early stages with like policy and litigation around these issues. And similarly, like schools have just recently started to try implementing cell phone policies just over the last few years, really. And so there hasn't been like a ton of formal research, and maybe Jill can speak. There may be some. Maybe Jill can speak to that. But I do know that there has been a lot of anecdotal evidence that yes, cell phone policies where that either limit cell phone use or ban them kind of bell to bell throughout the whole day have led to really positive change in school districts. Not to say that that transition isn't hard, because it is, and there's lots of implementation challenges. But there has been, I think, some data and a lot of anecdotal evidence to suggest that, yes, like teachers are seeing increased engagement, better focus in school, improved social skills. Like, one of the challenges that a lot of educators have expressed is that students have actually lost some of their basic in-person social skills, such as making eye contact. And when the phones are taken away, that can lead to kind of like a spike in anxiety and a spike in issues initially, but longer term, it does result in like better social skills amongst peers, better positive social dynamics, and increased focus and engagement in school and learning.
I totally agree. I would just add, I agree with Liza, the data are confusing and we don't have enough of it, especially in longitudinal data. There's some pretty good international data, but it's a little bit hard to apply to the US because our population is so different, right? So that doesn't feel like a great comparison. And some of the challenge with the national data is that it's comparing apples and oranges, right? So some districts have, as Liza said, like 8 to 3, no phones in any. Other schools, their data is it's 8 to 3, no phones during academic classes, right? And so can you actually say the same thing is happening, right? So that's the work we kind of have to tease out. But I completely echo Liza's point. It is clear across the country, we're seeing tremendous improvement in academic performance, particularly for kids who are struggling just, with classes before. The improvement seems particularly marked for that group. I also agree with the social skills. The couple of other things I wanted to highlight: teacher morale seems to go up significantly in schools where they're limiting phones. I experienced it as an educator as well. It's not that fun to sit up there and realize that everybody is watching YouTube videos while you're talking, right? So I think just that experience, or constantly feeling like you're fighting with kids about put your phone away, right? That's just not what anyone signed up to be a teacher, right, for. So I think we're really seeing improvements in teacher morale. And the other thing that I think is really exciting is we're seeing what they're calling class cohesiveness. And so class cohesiveness could literally be like the class of 2025 feeling more connected to each other as a group, but it could also be like a biology class is feeling more connected as a biology class. Like this notion of actually being in the moment and fully present with your peers, in addition to building the social skills that Liza alluded to, it's actually also seeming to have some effect on community building amongst peers, which I'm really excited about.
Thank you. Thank you both for all of this information. It is so helpful. I know we're going to continue this conversation, but I'm going to hand it over to Jessica for one last minute.